Picture this. A normal, healthy 15-year-old girl decides to go on the birth control pill to help alleviate her period cramps. Then, a couple months after going on the pill, she has a seizure that lasts so long that her family is able to get her to the hospital, to the emergency room during the duration of the seizure. Doctors can't figure out what's going on. They do a CAT scan. They realize that she's got a giant blood clot in her brain. Why in the world would a normal 15-year-old girl, completely healthy, have a blood clot in her brain? Well, they do genetic testing and they realize that she's got a mutation in a gene called prothrombin, a gene which is involved in producing clotting factors in the blood. So essentially, she just has thick blood. And then on top of that, she's taking birth control, which is a substance that increases the levels of estrogen in the blood. And estrogen helps the blood clot. So essentially, this increase in estrogen in her body pushed her over the edge and created a giant blood clot in her brain. This is an actual story from my boss, who is a pediatric hematologist. So, birth control, specifically the oral type, which is also known as the pill to the common public. Everyone knows someone on it. I've had several people tell me that they don't know a single female who is not on it. According to Daniels, Doherty, and Jones, it's actually becoming more common than condom use. In fact, 9.72 million women in the US are currently using the pill, comprising 16% of the population of women aged 15 to 44, which is what's considered reproductive age. This is the most common type of birth control method, according to Daniels, Doherty, and Jones. Additionally, only 42% of pill users use it exclusively for contraceptive purposes, highlighting how doctors are prescribing it for a whole host of reasons. According to the National Survey of Family Growth done by the US government, 31% of its users use it to reduce cramps or other menstrual pain, 28% use it to help with migraines, 14% use it for the treatment of acne. In fact, 762,000 women are currently using it and have never had sex at all. So since the birth control pill is so heavily prescribed today for both pregnancy prevention and other female-related ailments, it is essential that we understand the side effects of taking the pill, especially considering that doctors oftentimes glaze over them. Due to the high levels of estrogen associated with consuming the pill, blood clot and breast cancer development is a huge risk. And unrelated to estrogen, taking the pill leads the body to being unable to manufacture vitamin B6. Can't we do better for women? So the first issue is the formation of blood clots. So this case of the 15-year-old girl that I mentioned at the beginning may not just be a complete fluke. According to the Center for Young Women's Health, taking the pill increases the risk of developing blood clots 3 to 5-fold in adolescence. So risk of developing these blood clots increases with genetic variations such as the prothrombin gene that I mentioned earlier. And it's additionally increased by trauma, surgery, and then being overweight and smoking. So the increase in estrogen levels in the body due to taking birth control pills not only increases the risk of developing blood clots, but it also affects the development of breast cancer, a disease which is greatly affected by estrogen levels. According to the Susan G. Komen Breast Cancer Foundation, there are several studies that show the link between the pill and breast cancer. Some of these studies show that while women are taking birth control pills and in the months just after getting off of them, the breast cancer risk is 20 to 30% higher than women who have never taken the pill. And then the World Health Organization refers to the pill as actually a carcinogen, especially the version that has higher estrogen dosage. And this actually leads to higher rates of liver, cervical, and breast cancers. Additionally, Bieber et al. Found that the pill led to a 50% increase in breast cancer risk. So unrelated to the increase in estrogen involved in taking the pill can also lead to a deficiency in vitamin B6. According to Dr. Berezowski, vitamin B6, also known as pyroxidine, is a central coenzyme in all the energy synthesis reactions in the body. Additionally, it's involved in the biosynthesis of neurotransmitters, so it's super crucial. According to Dr. Bob Marshall, PhD, the reason that those who take birth control have a deficiency in vitamin B6 is because the pill destroys the body's ability to manufacture this vitamin. And it destroys this ability after taking the pill for just 1 month. So to kind of sum it up, The pill's worst potential side effects include developing blood clots and having an increased risk of breast cancer, and both of these are due to the elevated amount of estrogen in the body when taking the pill. Unrelated to estrogen levels, the pill leads to a deficiency in vitamin B6 as it destroys the body's ability to manufacture this crucial vitamin. Despite all this, doctors oftentimes glaze over the side effects when discussing birth control with their patients, and they end up prescribing it for pretty much everything. So before mindlessly filling you or your child's birth control prescription, consider all the risk factors. In addition to potential side effects that apply to everyone, you, like the 15-year-old who had the seizure that I mentioned at the beginning, may have a genetic variation that predisposes you to developing a serious physiological issue when taking the pill. And additionally, women deserve a better birth control option and a way to balance hormones that doesn't endanger their bodies. I think we can do better for women. There just has to be a better way.